welcome back. Well, we have Jeff Parker here. Hi, happy Monday. Hope you had a great weekend.
Good morning to you.
Yeah, it's been a crazy few days, I'm sure, for you. I know when we were here on Friday, we talked a lot about the vaccine information, and we're going to have more about that. But first, you would like to go over some of the COVID numbers.
Yeah, let's go over the numbers first, and then we can get into a little more data on the vaccine. So,
okay, great.
This is all data over the weekend. Now, sometimes the weekend slows down a little bit with regards to cases that they collect and everything, but with regards to the positive cases, is 1,448, which is down. We were in the 2000s, so that may be a good sign if that's a trend that we can stick with, but I want to make sure that sometimes it is underreporting. However, unfortunately, as you can see, 47 deaths reported, and a good amount of those deaths are unfortunately in people who are residents not living in skilled nursing or assisted care. We certainly had that too, 6 in skilled nursing and 8 in assisted living, but 33 residents in Orange County that were not. That number's gone up, which is unfortunate. And again, that may be a reflection of what we've seen in these high ICU cases in the past. Now, when we look down at our hospitalization and ICU numbers, they've stabilized. They haven't gone up. In fact, the hospitalization numbers are actually down from last week.
Good.
So that's good. ICU numbers have been real steady around that 540, down a couple to 538. So at least there's stabilization right now, which is a good thing that they want. Obviously, they want to go down, but if they can keep their hospitalization rates going down, I think the ICU numbers will ultimately go down as well. The key is are we bending the curve a little bit with regards to the positive cases? Because that's what where the impact is.
Right.
With the city of Laguna Woods, where our numbers are calculated, we're up to 288. So that is a jump from the last time we reported. I want to make sure that we were at 253 a week ago when we talked about it, so we're up to 288. And unfortunately, we went from 12 deaths to 14 deaths, so additional 2 deaths in that same week time frame. So again, it's to our residents out there, it's about being careful. It's about staying with the mask and staying with the social distancing. You don't want to get this. COVID is a very dangerous thing, and we've seen it especially in our age group here in the village where we're the most at risk. So as long as we can keep our efforts to do it, then we'll keep the curve down. That's what we want to try to achieve.
Right. And I think the good thing about what you pointed out in regards to the curve is if we are stabilizing, it's a good thing because now we're already past the holidays. We're well past the holidays and where they could have had that surge based on everybody getting together over, Christmas and New Year's. So maybe we are looking at a downturn.
I'm hoping. I think you're right. I think now we're at a time frame where we should have seen those major upsurges reported already, given that we're already in the 3rd week now of the month. So I'm hoping that's the case.
Yep. Well, good information. Thank you for updating us on that. And then, on top of that, there's a lot of vaccine information out there. There's a variety of companies who are providing a vaccine, and it's coming down the pike more and more. However, we have information. I know on Friday we really dove into it. So why don't you maybe give us an overview, kind of in a nutshell?
Sure. So what we said Friday and to the residents was that we've been working with Orange County Healthcare Agency, Memorial Care, and our own staff to try to see if we could get the vaccine implemented and put out to our community here at the village, as opposed to the five super pods, as they call them, which again is Disneyland, Knott's Berry Farm, the Orange County Fairgrounds, Soka University, and the Great Park. Those are the 5 areas. And again, they haven't opened all of those. They're still working on getting all those super sites up. And so we knew, though, that we had a very unique population here, of which when we did the calculation, we knew that we had over 9,000 of our residents that are 75 and older. So wanted to work on how do we get those people the opportunity to get the vaccine maybe sooner, get the vaccine without having to go through a major transportation process.
Yeah.
So they're here in the village. So we've been very fortunate, as I said, to work with the Orange County Healthcare Agency. They've given us 3,000 vials, I'll call them, in the sense of vaccination cases.
They've allocated them.
Yeah, allocated
Right, okay.
those to us. And we're working with Memorial Care, who's going to be administering that process here at the village.
Okay.
And we're going to use Clubhouse 7 as the location for that. And we're gearing up to start this on Friday, Saturday, and Sunday. It's going to be a weekend event.
Right.
Now the process, in order to, if you understand, is that 3,000 is only 1/3 of our 75 and older population. So we're having to do a randomized selection process. So we're going to go through and there's no priority here. There's not calling in and asking, hey, can I get bumped up the list? No, it's going to be a randomized selection process.
Right.
And those people will then be notified by Memorial Care staff that are assisting and with our administration staff to help them.
Okay.
But you don't have to call in. There is no calling in. Some residents sent emails saying, hey, call resident services. No, again, residents don't call resident services. We will be notifying you if you have an appointment coming up for this weekend. And then the key to that is if you do get picked in this randomized selection process and you get an appointment time, it's a very fixed system. It's not something where you're going to be able to go, well, I can't do 9 o'clock, I need to do 11 o'clock.
Right.
Unfortunately, we can't have a lot of changes in this plan or we're not going to be able to get those 3,000 doses out. So
Right.
if you get an appointment, please stick to that appointment. And most importantly, with regards to that, I want people to understand, if your appointment's at 9 o'clock, you show up 15 minutes early, don't show up an hour early. If your appointment's at 11 o'clock, don't show up at 10 o'clock. Show
Right.
up 15 minutes before your appointment. That way you can get the paperwork process. It's real simple. And then you can get your shot, see how you do, and then you're on your way home. And it can be very, very efficient if we don't jam up the system.
Right.
And what we've seen is up in Disneyland and everything, where people were showing up way, way sooner than they needed to. I know there's a fear factor here, but in our conversation and the trust that I have in Memorial Care to administer this, I think they know what they're doing and
Yeah.
they've gone through it. So again, randomized selection process. So we'll be contacting you, and then Memorial Care will be administering it at Clubhouse 7.
Do you happen to know, I know it won't be a drive-through, right? It's
Right.
it's a walk-in type of a thing?
It
And
will be.
So what if, for any reason, you're having difficulty, getting out of your car, or you have someone that's helping you, like a caregiver? What do you recommend that they do?
If you have a caregiver that needs to help you, the caregiver can come along. Caregiver won't be eligible for getting a shot. I want to
All
make that
right.
real clear, but the caregiver can assist you getting up to the location and where the staffing is. We will also have random staffing working in the parking lots to make sure people get to the right point in the right place and
Right.
get them logged in and get them taken care of, get their shot, and like I said, there'll be a little waiting period, so you stay around for a little bit, just make sure you have no reaction,
Yes.
and then you're good to go home.
And like you mentioned, Memorial Care has been dealing with this for some time now, so they know exactly what to do in terms of making sure you are distanced, making sure you have your masks. I mean, everybody will have masks, volunteers and all, so everybody has been prepped and the protocols are in place.
Yeah, and I think the real trick here, and I want to make sure our residents understand it. Again, we have over 9,000 seniors that are 75. So there's been a lot of talk. Well, the state said 65 and older. Yeah. We started this process knowing that our care that we were going to provide was 75, which was the first guideline that came out. We're sticking to that for two reasons. One, it is obviously the highest risk at the age. They've just statistically shown that. But secondly, what's more important is we only have 3,000 vaccines this time. And we hope to get 3,000 every weekend so that we can get this done quickly, and maybe even more. But the reality is we don't get an allocation until we show them that we were productive in implementing this.
Okay.
And so that's the key, that and the expectation that we have working with Memorial Care, because they're so good at this. that we will get additional vaccine allocations from the county.
Right.
So the county is providing those vaccines to us, and we're asking Memorial Care to administer that, and it's going to work out really well, I think. But I want to make sure that the residents here understand that there is a county website and an app that they can go to called Athena.
Yeah.
And if they want to go make an appointment on Athena and can get into Disneyland or Soka if they open that one up,
right.
and you don't want to wait, because remember, this is a random selection process, so you may not be until 2 or 3 weeks down the road. If you can get an appointment at one of the other facilities and you want to go, please do. We don't want to have you hesitate and wait. We want you to get in when you can get in.
Right, right. And interesting, when you mentioned the Soka one, that is definitely going to be up and running. I think they're starting this weekend. So, and to go on that website, the Athena one, I know it's problematic at times because there's an awful lot of people who are trying to do exactly the same thing. But just keep going on, every 15 minutes and see what you can get in, because so many people are trying to do it at the same time that it pretty much kicks you out.
That's great
So you
advice.
have to just keep trying. Don't get worried. You'll get there. It just takes some time to do it.
Oh, that's great advice.
Yeah. So that's good to know. At least they're opening up the rest of the facilities. Other than that, yes, you said don't call resident services. You will contact them. Can you tell me what the contact means would be?
They're going to either email people or they will follow up with a phone call to individuals. So we know that some people don't have emails, so that's obviously easiest communication. And the important thing with that is how do they get access to the 3-page paperwork or 4-page paperwork that they have to bring in and sign off when they do that. The email will have that as an attachment. If we have to phone somebody, we're going to give them the information, or Memorial Care will provide them the information of how they get the forms and where to fill it out.
Perfect. Let's talk a little bit about an interview that we're going to be having with Memorial Care staff.
Sure.
We're going to have a nurse and a doctor. Dr. Solomon is going to be with us, and we're doing a half an hour discussion about the vaccine, why it's good, what's going to happen, will you have side effects? How did that come about, and why do you think that was important to do that?
Well, when we were meeting with Memorial Care and trying to get this situated, we realized that there are so many questions that people are having out there with regards to the vaccine itself, and information about, is it safe, information about how strong is it, will it last, why 2 doses versus 1 dose, those kind of things. And those really are good medical questions that we felt that VMS staff weren't the appropriate ones to ask at. And since we have Memorial Care administering this program, we asked that they would partner with us and bring a doctor and a nurse on so that people have a comfort level and don't feel scared about this process, because we want people to get vaccinated.
Well, thank you. Anything else that we'd like to let the residents know about?
No, we'll keep them informed, and it's possible during the week we'll be on a little bit more. Maybe it's possible to come back on Wednesday to give more people, as we get closer to Friday, how it's going, how we're setting things up. And we just look forward to working with our residents. But again, I want to make sure patience, as we talked about.
Yes.
I know everybody's very interested, but this is really an effort to get something uniquely done here in the village.
Right.
And it's out of the norm. So again, our thanks to Memorial Care for helping administer this, and a big thanks to Orange County Healthcare Agency for supplying directly to us this amount of vaccines.
Yeah, it's a great thing that you guys were able to pull this off. So thank you. All right, very good. So we'll have you come back on Wednesday if you have additional information. Other than that, we will see you on Friday.
Definitely.
The calm before the storm.
There we go.
All right, thank you.
Thank you.
All right, when we come back, we'll have additional information for you about our movie and community. But remember, be very patient with regards to this vaccine information and distribution. Always check your e-blasts. They will be emailed out to you. And then, of course, you could always watch us here on Village Television, and we'll bring as much information to you as possible. Stay tuned.